opioid prescriptions at the pharmacy. What is the pharmacist actually looking at to make sure that we can dispense the medication? And just to preface this by saying, in 11 years, I've only refused a handful of prescriptions. So this is the exception and not the rule. So in Missouri, we have acute opioid prescriptions and we have chronic opioid prescriptions. Acute opioid prescriptions, our law says that for initial acute opioid prescriptions, we can only dispense 7 days worth. So that's pretty much the first thing I'm checking on those initial acute opioids. And then I do all the safety checks, interactions, allergies, wonky doses, that sort of thing. With chronic opioids, the state says that I have a corresponding responsibility when dispensing controlled substances to make sure that it is for a legit medical reason and that it falls under the normal treatment for that condition. So when I'm dispensing opioids for a chronic condition, I like to be able to have a diagnosis code. I note that in the patient's profile, and I can get a lot done with the diagnosis code. I'm looking at wonky doses, and then I'm doing drug allergies, interactions, all of those things. If the patient is on other medications that can cause like respiratory depression, we might have a Narcan discussion. The goal is never to refuse the medication. The goal is to make sure that we're dispensing the medication both safely and legally. It is not about my personal opinion or me judging anybody. I have family members, friends, lots of people I know who have to take controlled substance medications. It's never about judgment. It's always about making sure that I'm following the law and safety.